hello again. So I'm excited to talk to you this afternoon about concussion. I have no financial disclosures related to this talk. The only disclosure, this is a picture of my high school basketball team. I'm number 33. And the only disclosure I have is that this talk is really geared towards patients who are high school and older. I won't talk very much about young patients, first because I'm an internist and I take care of patients who are high school and older, and second because the data we don't have a lot of data in young kids. So when you think about this talk, it really applies to high school and older folks. I'm excited to talk to you because we have a new consensus statement that's been published about concussion. So there's some new information that I'm excited to share with you today about how you manage patients with sports concussion. This is available if you Google it, it's open access, the Berlin Consensus Statement on Sports Concussion. They convened in 2016. And so at the end of this session, I hope you'll be able to identify the three components of a sports concussion evaluation, be able to explain the average recovery time for kids and adults with sports concussion, prescribe cognitive rest in concussion recovery and physical rest in concussion recovery, describe a return to play protocol, and identify a patient to consider referring for a multidisciplinary sports concussion evaluation. So what is a concussion? A concussion is a blow to the head, neck, or body that leads to a force to the head. There's a rapid onset of neurological impairment that most commonly occurs within 48 hours. So it may not be right away, and often on the sideline of football, we don't actually see concussion present on the sideline. It may take till Monday morning after a Saturday game, but it should be within a couple days. We think of concussion as a functional injury rather than a macroscopic structural injury, and that's partly because our standard head imaging modalities are normal in concussion. In sports concussion, symptoms usually resolve in weeks on their own, but in some cases can be prolonged. Concussion may or may not include loss of consciousness. Importantly, concussion does not have to include loss of consciousness. And when you're dealing in sports concussion, it's really almost a diagnosis of exclusion. So the symptoms cannot then be explained by drugs, alcohol, medication use, or some other condition. All right, so starting with case number one, this is a 16-year-old high school soccer goalie who comes to an urgent care. She has wrist pain, but you're talking to her and she also hit heads with a teammate in practice earlier today, and she had 15 minutes of headaches and dizziness afterwards. She took a nap after practice because she felt really tired, and now she says, I feel fine. I have no headache, I'm fine. And so the question is, what do you do next? And so this gets down to what kind of evaluation is recommended in sports concussion. And really, we recommend a three-pronged evaluation. So that involves a symptom report by the patient, a neurological exam, and important to include balance, and a mental status exam. And in your handout, I've included a copy of the SCAT-5. The SCAT-5 is the most up-to-date it stands for the Sideline Concussion Assessment Tool. And the SCAT-5 will walk you through this three-pronged assessment. So if you are someone who sees sports concussion a fair amount, it's worth looking at the SCAT-5 and seeing how to incorporate that into your practice. We tend to use this at every sports concussion visit that we have with our patients in clinic. And so the SCAT-5 first contains a self-reported symptom assessment. This is a 22-item symptom score with a 0 to 6 Likert scale per symptom. And we give this to patients upon their arrival in clinic to fill out. In high schoolers, when I first started doing this, I was surprised we were doing baseline testing at UCSF for local high schools. And I would review all the baseline results. And I was really surprised by, at baseline, how many symptoms high schoolers have of concussion when they've had no concussion. And this study really talks about that. So you see that at baseline, having no concussion, a ninth grader will have about 17, a symptom severity score of about 17. So, when we think about concussion symptoms, we all have concussion symptoms at some times, right? You have a headache, you feel a little anxious, maybe you're tired. These kinds of things are normal. And so when you think about your concussion patients, realizing that if they come in with a fairly low symptom score, well, that may be normal for them or not. And you have to kind of tease that out. So the second part of the three-part eval is your neurological exam, your basic neuro exam. The purpose of this is to make sure that you don't need to do a head CT or a brain MRI right away. And then second part that you may do less of is a balance exam that's a little bit more detailed. And in your handout, I put some more information about the modified BESS, which stands for the Balance Error Scoring System. The modified BESS involves these 3 stances. This is in the SCAT-5, where the athlete stands in each of those positions for 20 seconds with their eyes closed. And then you score them based on how many times they make a mistake in that stance. So there are some norms and some scoring details in your handout. And lastly, mental status. So thinking about immediate and delayed recall in whichever way you want to assess that. But again, the SCAT-5 has that for you. So after you've diagnosed your patient with concussion, inevitably the patient will want to know, how bad is it? Because they're interested to know, when can I go back to school? When can I go back to sports? So how bad is my concussion? And the hard thing about taking care of concussion right now, one of the hard things, is that grading a concussion is entirely retrospective. And so we only know how severe your concussion is after you're better, which is sort of an odd thing. We can tell the athletes that typically it takes adults about 10 to 14 days to get better, and on average it takes kids up to 4 weeks. And so it's reasonable to let young people especially know, hey, this may take a month until you're back to sports, just so their expectations are set properly. There are some factors that we know are associated with slower recovery. And so when you see these in your patients, you may expect that it will take longer than usual to recover. That would be if they present with a much higher symptom severity score, or if they develop subacute depression or migraine post-injury. And children, adolescents, and young adults with pre-injury mental health problems and migraine have been shown to take longer to get better from a concussion. So case number 2, I'm going to ask for your participation on this one. So this is a 25-year-old woman who comes to your office for an emergency department follow-up 2 days after a bike accident. She slid out while she was crossing streetcar tracks on wet city streets. She had no loss of consciousness. She was taken by ambulance to the emergency room. She had a trauma workup, including a head CT that was negative. And she presents to your clinic with headache, fatigue, dizziness, and light sensitivity, and she's sleeping more than usual. You examine her and find that she has a normal neck and normal neurologic exam. And so how would you treat this patient? Would you, A, order an urgent head CT to rule out a subtle post-traumatic bleed and ask her to return to clinic after the CT? B, gradually recommend she return to work as tolerated and rest from biking and to see you in a week for follow-up? C, rest from work and from biking until she's symptom-free and see you in a week? Or D, return to work and biking now? So you can use your audience response pad and go ahead and log your response. All right, great. So we have a good spread. So some folks would like to re-image her head. Some folks would say return to work gradually now, or when tolerated, rest from biking, follow up in a week. And many would recommend resting until symptomatic and then following up with you in a week. And I think what I would do in this case is probably B here. So I would say, you know what, as you're feeling better, start to return to work. But definitely, because she's just had a concussion, not to return to biking, which is high risk. So we'll talk about this. What is the right treatment? So how much rest after a concussion? We know that concussion treatment involves rest. That's cognitive rest and physical rest. And medication, you can advise, acutely we recommend not NSAIDs just because of a theoretic risk of head bleed, but Tylenol is fine. I try to remember to ask people not to drive since they feel foggy and dizzy. I think that that's wise not to drive after a concussion, and certainly alcohol does not expedite recovery, nor do drugs. So how much rest after a concussion? This has been really debated, and we're learning more and more about this. I think the pendulum's really swinging around the idea of cognitive rest post-concussion. This study tried to look at that in kids. So this came out of the Children's Emergency Department at the University of Wisconsin. They randomized 88 patients who were ages 11 to 22. Half of them had a strict rest protocol where they really did nothing for 5 days. and the other half did strict rest for 1 to 2 days and then gradually returned to some cognitive activity and some kind of walking around, nothing high intensity as far as physical activity. They examined these patients at 3 and 10 days post-injury and found that they had the same neurocognitive and balance outcomes. And actually, at 10 days post-injury, the strict rest group had more daily post-concussion symptoms and slower symptom resolution compared to the group that didn't rest so long. So again, the group that rested strictly for 5 days actually had more symptoms and felt worse at the 10-day checkup than the group who only rested for a day or 2. This was surprising to a lot of us who've been recommending really a lot of rest post-concussion. And the Berlin consensus statement talks about rest, and I think this is probably, to me, the biggest shift in thought on concussion right now. So what they say, and I'm just going to read it, there is currently insufficient evidence that prescribing complete rest achieves these objectives, those of mitigating symptoms and or promoting recovery by minimizing brain energy demands post-concussion. After a brief period of rest, 24 to 48 hours after injury, patients can be encouraged to become gradually and progressively more active while staying below their cognitive and physical symptom-exacerbating thresholds. The exact amount and duration of rest is not yet well defined in the literature and requires further study. And so I think from this, we can take that the literature right now is supporting doing some activity post-concussion after a couple days of rest, but not so much that the symptoms get way worse. And so we are in our program starting to return young people and adults to school and work sooner than we used to. So after a few days of rest, as tolerated, starting to do more cognitive activity at home and gradually into school. And this graphic just shows one idea of how that might look. I recommend that students set a timer at home, do say 15 minutes of work, see how they feel. If that goes well, set a timer for 30 minutes and so on. And once you can do an hour or 2 at home, you can go back for a half day and a full day. I put in your handout this great reference. This is the California Interscholastic Federation website, which has really awesome concussion tools for clinicians. Included in this is a detailed physician letter to school after concussion. And so if you are seeing young people who go back to school, providing a letter that they can give to their school is super helpful. All right, case number 3. This is a 15-year-old high school girls soccer player who comes to concussion follow-up in your clinic. She was injured a week ago, and she rested at home for 2 days and then gradually returned to school with your return to learn protocol. She's tolerating school 100%. She has no issues with school. But she hasn't done any physical activity yet. She has no concussion symptoms. She tells you her soccer championship game is in 2 days, and she'd like clearance from you to play. I already see many people shaking their heads. What do you recommend? Okay. So 15 years old, she's better from her concussion, tolerating school, major championship, 2 days away. Would you A, clear her for the game in 2 days, B, clear her to practice today, and if she has no symptoms, clear her for the game in 2 days, C, clear her for practice today and follow a gradual return to play protocol of 7 days, D, recommend 1 more week of rest from physical activity and then follow up with you for next steps. Or E, recommend she stay out of soccer for a month and then follow up with you for next steps. All right, so looks like 25% of folks would clear her to practice today, and then if no symptoms, clear for a game in a couple days. So no one thinks you can just clear her. We're all agreed that no, she should do like something before you say, yeah, go play in this tournament or this championship. So 1/4 of folks think clear her today and then go ahead in 2 days if you're all right. And then a bunch of people think, no, do a more gradual. And then some people think, oh, let's keep her out a bit longer. In this case, I would do C. I agree with the majority of you, and I'll tell you why. So we do have in the state of California, there are a number of laws around concussion. The first of which was in 2012, really saying that there's no same-day return to play. So if a student athlete has a concussion, they need to be done. That's sort of what the first law said. Also, this mandated that at public school, high school, or in public schools, kids would need a clinician letter to return to play. In 2015, the concussion safety law came out, which mandated a return to play protocol of no less than 7 days from the diagnosed date of concussion. And so it is now legislated that student athletes must have at least a 7-day return to play protocol, and that this must be under supervision of a licensed healthcare provider. And so a typical return to play progression would look something like this, where once the student athlete has no symptoms, they're doing daily activities that don't provoke symptoms. They could then do light aerobic activity, something sports specific, and then non-contact training. I usually like to see student athletes back here, that's why there's a star, to make sure that I want to clear them for full contact followed by a game. And this now by law, again, should be 7 days, at least. What are these return to play ideas and why do we do it this way? So the reason is that sometimes as you're returning someone to play, they'll have a return of some concussion symptoms, and it's better to have that done in a non-contact environment than a game environment where they would be higher risk for re-injury. And so we think that it's smart to sort of first work on getting your heart rate up, then work on things that require more movement, then work on things that require more coordination and higher cognitive load, and then work on building confidence around contact and collision, and then return to a game. So it's this really just building back up the confidence to play in a game. Again, I'll refer you to the California Interscholastic Federation website, which also has really good tools around returning to play handouts for your student athletes. All right, case number 4. This is a 23-year-old semi-pro rugby player who came to see you 3 months after her 5th concussion, which she sustained when she was elbowed in the head during a game. She has had a headache with light sensitivity since the injury. She'd like to know if and when she can return to rugby. So first, what's her diagnosis? And second, what do you worry about? So in this case, this is one of my patients. She has what's called post-concussion syndrome. So she has concussion symptoms that have lasted longer than typical. We don't know, the definition of post-concussion syndrome is not well delineated. It's that concussion symptoms last longer than some say 6 weeks, some say 3 months. But nonetheless, it's when concussion symptoms persist longer than usual. The frequency is unclear because our follow-up of a lot of these patients is not great. Patients do, we think, benefit once they have post-concussion syndrome from a multidisciplinary treatment protocol. And so when we think about these patients and returning them to play, I like to think about it in 2 ways. One is, what's the short-term risk of her returning to play? And then what's the long-term risk of her returning to play? So in the short term, we know that patients who've had 3 concussions are 3 times as likely to have another concussion than someone with no history of concussions. So clearly, a history of concussion predisposes you to having another concussion. And furthermore, studies have shown that those future concussions, you're more symptomatic and they last longer. So they become more and more disruptive to your quality of life. What about the long term? So in the long term, I think we've heard a lot about chronic traumatic encephalopathy, or CTE. CTE has been found to affect athletes, military personnel, and survivors of intimate partner violence. It's a chronic progressive neurodegenerative syndrome involving depression, cognitive impairment, and aggression. Presently, it can only be diagnosed at autopsy with a very specific pattern of tau protein deposition. And it's been difficult to draw causality because there's no prospective data on this. But interestingly, there have been no reports of CTE without preceding traumatic brain injury. And so clearly there's a concerning association between participation in collision sports and long-term neuropsychiatric problems. And so I'd encourage you to think about post-concussion syndrome when you have a student athlete or an athlete where their symptoms aren't improving. So remembering that adults, we expect them to be better within a couple weeks, and kids around 4 weeks. If they're unable to return to school or work after a couple weeks, if they have a history of migraine, anxiety, depression, or a sleep disorder, they're at risk for this, or a history of concussion. And so these are pictures of our multidisciplinary team. As Anthony said, I co-direct our multidisciplinary concussion program, working with sports medicine doctors and neurologists, physical therapists, neuropsychologists to help folks who've had chronic symptoms get better. And we really try to attack their symptoms from every angle possible from a rehab perspective. Talking to this athlete, who's the 23-year-old pro rugby player who'd had 5 concussions, the question is, well, how many concussions is too many in some of these people? And I think it's important to individualize this question patient by patient. We don't have any data right now that sort of says, oh, well, 3 strikes, you're out. Like after your 4th concussion, you're done. It really does depend on what the injuries have been like and how they affect this person. But when you run into a patient who's had more and more concussions with less and less force, start to think, you know what, this is not a good pattern. And so I start talking to people. Have you thought about other sports? So I'm a sports medicine doctor, right? So it's not about like retiring from sports, but what is your next sport? Because we know that there are sports that are lower risk and there are sports that are higher risk. This is a graph from the NCAA showing just the amount of impact you can expect from different sports. So up top, contact and collision sports would be stuff like lacrosse, wrestling, also pole vault. Limited contact, I mean, it's sort of, common sense, but like bowling, all right, rowing, volleyball. So there are some things that like you might not expect, which is that, something like basketball is actually kind of in the middle, baseball is in the middle, softball in the middle, gymnastics even surprisingly falls in the middle, less risky than something like football. And then there are good epidemiological studies looking at incidence of concussion. This is very debated, so what's more risky, rugby or American football? Depending on the study you look at, incidence will be higher in one than the other, but both are collision sports, and so both have a high incidence of concussion. You can look at boys versus girls, which is interesting. In high schoolers, we have consistently seen that girls are higher risk for concussion when you look at participation in the same sport, most commonly evaluated as soccer. We don't really know why that is. But you can look at studies like this and say, okay, I'm seeing a football player. Well, what sport can we transition to that would be lower risk? And say, okay, well, the incidence here is 0.53 per 1,000 athlete exposures. Basketball is 0.10. I mean, that's a good decrease in risk. And then inevitably, we all have patients who are totally wedded to their sport. They are not going to switch no matter what. And so then I start thinking, well, okay, is there anything we can do to modify your risk in your existing sport? And you can take a position that's lower risk within the same sport. So studies have been done showing what are the highest risk sports or positions by sport. Water polo, it's the goalie. Baseball, it's the catcher. Football, quarterback. Running back, then linebacker. Ice hockey, it's the forwards. Soccer, goalkeepers again. And volleyball, the libero. And so thinking about switching the position to see if you can minimize the risk of exposure. In your syllabus, I have put some concussion resources. Our email is there, our program email if you have questions or cases you'd like to discuss is concussion@ucsf.edu. The CIF website is there, as well as the website for the consensus statement published in 2017 from 2016, as well as the CDC concussion toolkit for clinicians. So I'll leave you with these take-home points, remembering the recovery time on average is 10 to 14 days in adults, 4 weeks in kids, to use a 3-pronged evaluation, so symptoms, neuro exam plus balance, cognitive exam. Remembering to follow a gradual return to learn or work protocol that can start 24 to 48 hours post-injury. Remembering that in California, we are following a 7-day gradual return to play protocol. and to consider referral for post-concussion syndrome, and to remember to use an individualized approach for folks who've had repeat injuries. So with that, I'll finish, and I'm happy to take your questions. Thank you for your attention.